Welcome to the Crescent City, where Vital Options is in New Orleans with ASH, the American Society of Hematology. When it comes to palliative care, what we're trying to do is redefine palliative care so it is not simply associated with end-of-life and hospice care, and that we understand that palliative care is part of integrated medicine and connects the dots throughout your entire cancer treatment experience. Meghan, there's a reason we're talking about this, and I'm going to let you open it up as to why you are so passionate about this area.
Well, certainly. Thank you again for inviting us. This is an incredibly important topic to people who have been affected personally by a blood cancer. Almost 1.6 million Americans will be diagnosed with cancer this year alone. And we know almost immediately these patients will face complicated decision-making processes, including multiple treatment options, discussions with multiple providers, often across multiple specialties, really underscoring the need for better coordination of care and communication with patients. Cancer care professionals typically counsel patients with information on diagnostics, staging, treatment options, palliative care, as well as long-term survivorship. And particularly in the face of a cancer diagnosis, this can be incredibly frightening and intimidating for a patient. And we know from our collective experience, as well as from a growing body of evidence, that patients benefit from a written plan that details every element of care, including long and short-term effects, treatment side effects, prognostic information, as well as the various services that they and their caregivers can take advantage of to really shepherd them through their cancer experience.
Cancer care planning is different than palliative care.
Yes.
How do you define cancer care planning?
The concept of cancer care planning is relatively new, but very simple in its origins. Again, a written care plan that details the various options that a patient and their healthcare team can employ to, again, help shepherd them through their personal cancer experience. Because receiving a cancer diagnosis, again, can be so incredibly intimidating, we know to have an important resource like a cancer care plan can really help a patient feel confident in their decision making, and we know it can also improve communication between a patient and their healthcare team.
So what are some of the issues that really differentiate both cancer care planning and palliative care when it comes to blood cancers?
The way that I think of palliative care is that it's specialized medical care for patients and families facing a serious illness setting. So while cancer care planning encompasses lots of sort of what-if types of questions for the future and making sure a person understands all of their options and the scope of treatment, palliative care really focuses on helping patients and families live well while they're going through that journey. And so it might, for example, focus on very aggressive symptom management, which is something that we unfortunately don't often do all that well in our oncology practices. But then again, as a person gets maybe closer towards the end of their life, it could even encompass more end-of-life care, like hospice care, or helping with advanced care planning, deciding about the aggressiveness of treatment interventions a person might or might not want towards the end of their life.
Because there are so many misconceptions about palliative care, a patient might jump to the wrong conclusion if their healthcare team addresses the topic partway through or once their treatment is underway. I think what a cancer care plan enables a healthcare provider and a patient and their caregiver do is to address all of these important topics at the very beginning of treatment. So if they need to readdress the topic later, it's not a new concept.
To me, it gives a patient and their significant others a sense of control.
Absolutely.
A roadmap, a direction. Scott, in your role at LLS with education, what are some of the barriers that we face? Because there's sometimes people, they're scared, and even though we know that information gives you that sense of control and power, sometimes it's difficult to encourage people to want to hear, want to get information.
There are more than 1 million patients living with blood cancer in this country today. right? And as an organization, we are committed to providing a voice for those patients. Whether we hear from them through our 60 chapters in the US and in Canada, we get 60,000 inquiries from those patients to our Information Resource Center every year. And the key for us is you have to meet them where they are. And you just hit it, which is a diagnosis of cancer, a recurrence of cancer, a loved one with cancer is an onslaught. And they may be at very different places, and we have to help them get that control, get that sense of, this is the piece that I can handle right now, but I know that there's somebody that I can go to when I'm ready for more. And these plans, I think, are really terrific because they help, sort of codify, okay, I've got something, well, this is just something tangible that I can wrap my arms around, and when I go to the physician and I'm thinking about this, it helps me mentally set my expectations for what might be coming and just begin to feel like in a small way I have control over some piece of this.
So it seems to me, Meghan and Scott, that one of the most important areas of education from your organizations is exactly this idea that patients reach out willingly to an integrated approach to include palliative care and to redefine their perception that palliative care isn't end-of-life care, but it is part of the circle of the continuum of their care.
Absolutely. I think education and access are two important issues that the Lymphoma Research Foundation has been focusing on regarding cancer care planning and palliative care. Certainly patient education around this entire concept, which is still relatively new for many patients, to educate them on the need for a cancer care plan and to learn more about palliative care. On the access side, generating the resources necessary for a healthcare provider to actually provide this service is another issue that we've encountered. And so we've worked very carefully with Congresswoman Lois Capps to support her PACT Act, the Planning Actively for Cancer Treatment Act, which would actually create a Medicare reimbursement coverage, basically, for this service that would allow a healthcare provider to be appropriately reimbursed for their time and expertise in creating a written cancer care plan with their patient.
We have to help patients understand they define better, right? I mean, longer is easy to measure, but better means a lot of things to different people, and we need them to engage as advocates for themselves about what does better mean to me.
Right, and it really boils down to, palliative care equals quality of life care, and then it is up to the patient to decide what that means. And we're very, as a society, as a culture, it's very easy for us to, if someone says, I've really had enough, I'm done. Well, you're not fighting hard enough, and you need to be more aggressive, and you got to do more. But at some point, less is more. And the choice to say I'm done shouldn't be met with judgment or making one feel that they've become a victim instead of a survivor. There may be times where no treatment is the treatment of choice, and that's a kind of a stigmatized discussion, is it not?
It is, absolutely. I would love to see one day that the care we're providing would be concurrent, appropriately aggressive oncology care and aggressive palliative care, such that you can change the balance or the focus of each of those things much more seamlessly. Because the way that you've described it, which is exactly how it is in practice, is that it feels like it has so much finality. It's just this sudden stop at the end of the road, and now I don't have treatments to offer you, so I'm going to send you to this other place or person, and there are issues of abandonment, and we have to work together.
Where other areas of medicine are more black and white, this is fluid, and this is gray, and can change in a day and flips on a dime. Thank you to all three of you for bringing perspective to this really vital subject.
Thank you.
Thank
Thanks
you.
for having me.